So immunization is one of the most cost-effective public health interventions. It's not new, it's been on for over 4 decades now, but we had a great opportunity as CHAI to facilitate the rollout of 2 new vaccines, the pneumococcal vaccine that protects against pneumonia and the rotavirus vaccine that protects against children against severe diarrhea. And so in partnership with the Gates Foundation, we have worked with a number of governments, the government of Kenya, government of Ethiopia, Malawi, Nigeria, to roll out these vaccines. So what CHAI did was really to, on one hand, work at the global level in reducing the cost of this vaccine, particularly the rotavirus vaccine, and at country level to project manage the introductions. And these are nationwide rollouts. And within a day, these vaccines were available in all the health facilities in these countries. So you can imagine a birth cohort of 3 million in Ethiopia, for example, 7 million in Nigeria, 1.5 million in Kenya. You do this, within one day you roll out this vaccine and it's available to all children who sought it.
For vaccines, the biggest issue is that there's a high cost upfront, but at the same time, you're making an investment far in advance of the actual vaccines being produced and being sold in country. Our aim is to ensure that there's affordable pricing of vaccines for children. By providing manufacturers with a volume guarantee, this means that we will guarantee you a large volume of purchases in the future. That way, manufacturers could do 2 things: have a large number of volumes to amortize the cost over, thus reducing the cost per dose, and secondly, have a certainty of how much they're going to sell in the future. That way, they can plan their production and be very, very efficient. That way, their cost goes down, and in return for the volume guarantee, they are giving us a very low price.
India has a very ambitious immunization program. The Prime Minister recently announced addition of 4 new vaccines. CHAI has had extensive experience in introducing new vaccines in many African countries, and I think there are a lot of lessons that we have learned that can be applied to our work in India.
And I can say in a country like Ethiopia, we actually accelerated the introduction of the pneumococcal vaccine by 2 years, averting an estimated 30,000 deaths every year. So we've built a competency in helping project manage these introductions, but also helping governments have a good understanding of what are the key pieces that need to be in place in order to introduce a vaccine. And one of our great pieces of work now is in expanding cold chain capacity, because these vaccines need to be stored between 2 and 8 degrees centigrade, but also helping in temperature control and management to ensure that these vaccines are of quality and maintain their potency throughout the supply chain. So from the national level, regional level, all the way to the health facility level. That for me is the beauty of CHAI, large scale impact, the breadth and also the depth.